Thank you so much, everyone, for joining us today to learn more about CliniSync, Ohio statewide health information exchange. We tried to make sure that this presentation was a little less technical in nature and more of an overview of sort of a 101 of health information exchange in Ohio, specifically related to CliniSync. I wanted to give you a global view of what health information exchange is, and then let you know where we are with CliniSync, where we're heading, and how we can assist you with your needs. So before we dive into the presentation, I wanted to take just a minute and just have you think about the paper world and what your current experience is at a doctor's office, whether you're there as a patient or you're the practice manager or in some administrative position or you're the physician. So the paper world can be very cumbersome, can be frustrating and slow when you compare it to other industries. Often you have to rely on patients for a history of their information, filling out paper forms from the patient perspective. Sometimes physicians or offices are in a situation where they need to reorder tests and x-rays that have already been taken somewhere else, but it's proven too difficult to get those previous test or x-ray results. Lots of calling or writing letters to other practices or doctors to get information. And sometimes this process can take days or weeks to wait for the information to circle back to your physician. So that's sort of, we just wanted to paint the picture of the paper world today, and then talk about, and the focus of this presentation is really what the electronic world and specifically CliniSync can do for you. So in an electronic world in a physician's office, it's easier for providers to communicate with each other. The patient would ideally only have to fill out certain types of information once, and that history and other information would be available to that physician the next visit or to other physicians treating that patient. Using electronic charts rather than paper charts, which are more secure and also easier to find, and avoiding losing charts, and ideally fewer faxing and phone calls. So there's also, we see a reduction in duplicative tests or missing information, and general just better care coordination for patients. In addition to an ER having access to patient records if the patient ends up in ER and isn't conscious. So the vision that we want to show of this electronic world, we thought the best way to do that would be to ask one of our participants, someone who's been involved in helping us shape our services and policies. So we asked Donna Johns of Little Flower Practice to give us an idea of what kind of a difference she thinks that HIE could make in her practice. So she frequently will encounter a patient that has what they call a trifecta of conditions. So a patient that has diabetes, hypertension, and high cholesterol. And they come to her office as a primary care doctor for care. So, and in the example she gave us, the patient also has chronic systolic heart failure and is being treated by a cardiologist. So Donna needs to make sure that that patient has a diabetes test, that her physician has reviewed a cardiac echo, a CMP, that she's got a nutrition report on file from the hospital, as well as perchance an eye exam from the patient's ophthalmologist and a foot exam from a podiatrist. Instead of having to call all of this patient with this trifecta of conditions doctors to get all this information, in an electronic world using a health information exchange, she could get these results and reports electronically and pull them into her system so that she doesn't have to make copies of paper or re-enter information. So that's the ideal world where we and other states across the nation are heading. So now we'll dive into today's session, and our goal today is to explain to you what the Ohio Health Information Partnership is and what CliniSync is, to show how we connect hospitals and providers throughout the state, so where we are today and where we're going in the future, and for those of you on the call to develop a broad understanding of HIE activity in the state and the role that it will play in your practice. So to begin, we're going to start with the HIE activity at the state level. So we want to make sure we share with you who's participating at the state level. So the origin of the Ohio Health Information Partnership it's a nonprofit driven by stakeholders and was created by 5 founding organizations: the Ohio Hospital Association, the Ohio State Medical Association, the Ohio Osteopathic Association, BioOhio and the state of Ohio. And all these organizations had a vested interest in success in creating a successful coordination of care for the citizens of Ohio. And they currently serve on our board of directors, and many of them also serve on other associations and in other smaller committees that we have. So these organizations came together and formed the Ohio Health Information Partnership, and that's where we originated. And we've come a long way since we first were created and received federal grant dollars, and we've moved forward creating a sustainable organization to provide the health information exchange services we're going to go through in today's session. So what is our organization's mission and vision? So as the state designated entity for HIE, we focus on educating and guiding providers through selecting an EHR and then adopting it and getting to meaningful use. And then we're also, and this is through our Regional Extension Center program, and then we also are working to create a robust network to connect those physicians after they've gotten on EHR to other physicians and hospitals in their communities. And we manage that network so that the physicians and the hospitals can talk seamlessly to one another. And as of today, we've signed up more than 6,500 primary care physicians to help them pick and use EHR, so that's part of our Regional Extension Center program. And we're actively working with physicians to sign them up to participate in the health information exchange. So moving on to, I talked a little bit about the EHR, and I know in my original going over the paper-based world and the differences, the EHR makes a huge difference for practice, but going past that, actually connecting practices to each other, that's the role of a health information exchange. So that focus on sharing information on a patient across disparate health systems and disparate EHRs and of primary care doctors, specialists, and labs. So often one patient will see, they'll have an incident in the hospital, they'll see a specialist, they'll see their primary care doctor, they'll go to their optometrist, and the idea is that all of these treating providers will be able to communicate with each other and see each other's information so they can provide the best care to that patient. So this health information exchange that I just explained in Ohio is called CliniSync. So CliniSync is the technology, and it's the name that we've given to the health information exchange. If you can think about it as an umbrella. So CliniSync's the umbrella under which all of our health information exchange services fall. So we have different ways to connect to physicians, but they're all, we generally refer to them as CliniSync as the technology. So I've already stated this, but just want to reiterate that our goal is to connect all types of physicians, hospitals, and this includes behavioral health physicians, long-term care facilities, public health agencies. We work closely with the Ohio Department of Health, as well as commercial labs, and we've started to work with health plans as well. So our current footprint consists of 70 hospital partners that you can see on this slide. Hopefully you've got your screen blown up pretty big, because it could be a little bit of an eye chart. But we've got 70 hospitals who have contracted with us to participate and share information. Of the 70 that we've contracted with, we've got 20 that are currently live and sending information today to physicians in their community. And we anticipate that the rest of the hospitals will be connected by the end of this year, by the end of 2013. Now, we focused on doing our implementations with the hospitals and doing the contracting with the hospitals first. And we've also started to reach out to the physicians in those hospitals' communities. And currently, we have over 1,000 physicians that are in contract to participate in CliniSync, and that number is growing on a weekly and even daily basis. Okay, so now that I've given you a bit of an overview of the activity across the state, I'm going to let you know what services we have available to physician offices today. And I say physician offices, and again, that includes specialists, long-term care facilities, really any kind of care provider, not just a physician office. So our first phase involves sending information. So sending information from one trusted person to another. And that's the phase that we're in right now. So what we can do is we can send information from one physician practice to another via one tool. You can also send information such as results from a hospital to a physician practice unsolicited. And I'll get into more what unsolicited means. But that's really the focus of phase one, is just sending information from one to another. So the services we offer to do that, it's software that there's no charge to you. We use the federal funding that I referenced earlier that helped create the Ohio Health Information Partnership. That funding subsidizes the services and the software available to you in phase one. We can install the services I'm going to go over in your office in about an hour. Sometimes it takes a little bit longer, but about an hour is a good average. We can deliver results and reports from hospitals that are from the 70 hospitals that were on that earlier slide that are participating. And what's great about that result delivery service is that it's unsolicited in that if you're the physician of record, you'll receive information about your patient. So if your patient is admitted to the hospital or goes to the hospital with an order and they've got your physician practice down as their primary care provider, you're going to automatically receive that information without having to go out and search in the hospital system to retrieve it. And you'll also get it very quickly. It's almost real time when the final result is released. You can also reach out to other physicians that you refer patients to, and they can participate. So we strongly encourage that the people that are working with us and have contracted with us reach out to the other physicians in their community and encourage them to get on this no-charge system to electronically exchange information. And if you choose to receive results discreetly into your EHR, we worked with EHR vendors to negotiate the best price possible for you. So I don't want to be, I mentioned that there's no charge from us, and there will not be a charge for these phase one services in the future, but there may be a fee from your EHR vendor, from your Allscripts, eClinicalWorks, or whatever you happen to have, if you want to receive a result discreetly. And I'll get into more detail on that later, in a later slide. So first, encrypted email. This is sort of the, if you just want to put your big toe in the water, the first step to exchanging just information from one physician to another can be done via encrypted email. This is our direct email application, and it is HIPAA compliant, and it's part of the direct program that the Office of the National Coordinator has supported and pushed out across the country. So this is very easy to set up, and again, it allows you to do what you can do today with Gmail or Yahoo, only it's again HIPAA compliant, secure, and you know that the doctors that you're sending information to have already gone through our screening process and our identity proofing process, so you're sure that they are who they say they are. The second service is Referral Management. Sometimes we'd like to call this Direct Plus. So this is the same concept as sending an email or a referral from one practice to another, but there's additional functionality in that it creates more of a closed loop, because you can track whether that referral was accepted by the physician that you sent it to. So if you're both on our referral system, then you can send a referral from one practice to another, and the practice that you're referring to can even set up certain questions that they would like answered before they accept the referral. And this allows you to better coordinate care, and if you are working with multiple practices who are all on different EHRs, this tool could really help you eliminate faxing and having to make phone calls, and you could manage your referrals electronically. The last piece, and the one that we find most of our clients are the most interested in, is results delivery. So we deliver results. This is also, all of our services are HIPAA compliant, but it's also very fast, as I mentioned earlier. It's a quick way to receive test results and clinical reports from a hospital that we're working with. So there's three different ways that if you choose to, you would need to choose to receive results, but then also have a hospital in your area that's contracted with us and is live and ready to send results. So if that situation is applicable to your practice, then there's three different ways that we can send results to you. The first is a very simple PDF file delivery. So we'll just deliver a PDF to a file that you've identified on your computer in your office, your system, and that information will just be sent there as soon as it's released from the hospital. The second is through our inbox. So this is a software that we would load on your computer, and after we've done that, the result will be delivered to the inbox, and after it's delivered, you'd have the ability to sort the information, to see what you opened and what you haven't, print it out if you wanted to view it, move it, filter it based on certain things. So it's a step up from just having it delivered via PDF. The third is EHR integration. So you can receive results and reports from hospitals directly into your EHR. So that's discretely and structured results. So the result will be delivered to the EHR. You'll get a little notification that you have a new result to review, but it'll be automatically appended to that particular patient's file, and there won't be any manual process that you'll have to go through. So to go into a little more detail of how the sending of results actually happens, so if you look on the box on the left-hand side of the screen, reports are originated, well, the results are created in the hospital system. So that a test is run and the result is created by that hospital. It's sent to us at CliniSync, and what we do in that middle pink box is we normalize the information and we identify who we need to send it to based on information that the hospital took as part of their admitting process, as far as who the physician of record is, who ordered the result, that sort of thing. And then we route the information to a physician's office in one of the three ways that I just explained, either via PDF file delivery, the inbox, or directly to an EHR. So we've spent a lot of time and have been working really hard to negotiate the best terms with EHR vendors to create this one single interface for them for practices with these vendors to get results from any of our hospitals through one pipe. And what we do is we negotiate the price of the interface, we negotiate the functionality that you can expect to get, and we try to negotiate the amount of time that it will take. We do appreciate all of our pilots, and all of the vendors listed on this screen have been part of pilot projects. Pilot projects tend to take a little bit longer than our second, third, or fourth, but we try to negotiate the time that it's going to take for an EHR integration to take place. So we currently have interfaces live with Greenway, Glenwood Systems, DigiChart, Doctors Enterprise, EMDs, Allscripts, Athena Health, Metasoft, NextGen, Medical Office Online, and eClinicalWorks. So if your practice has any of these, one of these EHRs, the process for you to receive results into it, we've already identified the price, the functionality, and that integration project would go fairly quickly. We're actively working with the vendors on this screen, and there are others in addition to the vendors listed on this screen, to come up with the same standard functionality, price, and time to delivery. And I do want to mention, we will work with any EHR vendor that can consume HL7 information. So HL7 is a little technically of a term, but as long as that vendor is willing and able to work with us, we will start a pilot project with them. So there's no vendor that we won't have a conversation with. Okay, now that we've kind of covered results delivery, I did want to call out that we can help you with meaningful use. So certain components of the software can help you have an easy way to achieve certain measures and meaningful use. So for starters, the secure email messaging that I mentioned earlier can help you satisfy core measure 14, which requires you to exchange information electronically with another care team provider through encrypted emails, including attachments. So we can help with that. And then with stage 2, as we move into stage 2, we'll be able to assist you with meeting menu measures pertaining to clinical lab test results, sending transitions of care summaries, immunization data, syndromic surveillance, and lab results. This slide, we just wanted to show some of the accolades that we've gotten. And when I say we, it's really Ohio, not CliniSync. But Ohio has been recognized at the national level as a successful health information technology state. The leaders from the Office of the National Coordinator actually did a case study on us that's available on our website, just explaining all of the work that that we've done in collaboration with HealthBridge, with the Midwest Community College Consortium, and other partners that we've worked with and collaborated with over the past 3 years. So we also were recognized for our high numbers of meaningful users. So I'd encourage anyone who's interested to go on our website and to read more about that case study. So what does the future hold for us in phase 2? And more importantly, what does the future hold for you as those providing care in Ohio? So in phase 2, we'll turn on the ability to search for clinical information about a patient. So if you'll remember, when I was explaining phase 1, I said it was really about sending information point to point from one physician to another. In phase 2, it's about searching for information about a patient that's in your office. So if you've got a treatment relationship with a patient, maybe they're a new patient, maybe they were referred to you, and you want to look at all of the information available from treating providers that are on CliniSync, you'll be able to do that and to pull that information into your system. And we'll be working to create similar presentations for an overview of our phase 2 services. So now, how do you get started if you're interested in our phase 1 services? So first, all you need to do is you can either register on our website at the web address is on the slide, or you can work with a physician liaison, someone on our team who will send you a contract that you'll need to sign, and we'll start the process. And I've got a slide that has the contact information for all of our physician liaisons, and if that's how you're most comfortable, you just want to talk to someone in person, we're happy to facilitate that. So after you've signed a contract or have registered on our website, well, you need to sign a contract and register on the website, but depending on the order in which you do that, we'll need to go through an identity proofing process for those who are interested in direct messaging. And this is really just to ensure that you are who you say you are, and that when we move forward in exchanging information across state lines, and then just exchanging information from one community to another, that we've got proper verification of the providers who are on the system. After that, we'll contact you to schedule an installation and training, and this training can take it can take as much as an hour, as little as 30 minutes. And if the hospital is live in your area and you want to receive results, then we'll work with you to set that up via either the PDF delivery, the inbox, or an EHR integration, depending on what your desire is. So this slide, probably the most important slide of all of this presentation, lists all of our wonderful CliniSync physician liaisons. So these folks are out there, and we've divided the state into different regions to help you go through everything from the contracting process to making sure that you're live and you're able to either send a direct email or you're able to receive your results. And they'll act as your advocate if you choose an EHR integration, and be the project manager for your practice, and are just wonderful folks to work with. And it's just a slide of our staff. So our liaisons are in this picture, and just want to let everyone on the call know that our entire implementation team is here ready to assist you.